children asking Minister Philpott, can you please help my mother from Lyme disease?
Jennifer Kravis asked families to share their stories, hoping they'll deliver a strong message to the health minister.
We've received letters from thousands of Canadians all saying the same story, which is cases being missed, doctors not being aware of how prevalent Lyme disease is, people being refused testing, and this is happening.
Kravis says it happened to her 10 years ago.
Could no longer get up, care for my kids, couldn't work, and I was diagnosed with fibromyalgia and chronic fatigue syndrome.
She says she was eventually diagnosed with Lyme disease at a clinic in the United States.
We have listened.
The federal government announced today it's putting $4 million towards researching Lyme disease, boosting surveillance, best practices for testing and treatment, and public education and awareness around the bacterial infection that's carried by tiny blood-sucking ticks.
There's still much work to do in the area of diagnosis and best treatment practices, and this research will be tremendously important in enabling that.
If caught early, Lyme disease is treatable with a short course of antibiotics. Problem is, the symptoms mimic the signs of other illnesses, including the flu, arthritis, and fibromyalgia. If you wait too long to get treatment, it can lead to long-term health problems.
We need mandatory retraining of all our health professionals.
Kravis spent 2 years on antibiotics through an American doctor, but doctors say long-term antibiotic use has been tested and not shown to work.
And that's why Canadian physicians who are practicing evidence-based medicine are reluctant to provide that.
So while everyone is welcoming new money and research around Lyme disease, experts insist prevention is key. Christine Burak, CBC News, Toronto.